All right, next case. So now, this is a very difficult patient. She has been to 9 orthodontists. So when she came to me, she has been treated by 6. She has been to 9. So I thought I'm going to send her home and never touch her, but she ended up being one of the best, most loyal patients ever. And I'm glad I treated her. She actually helped us to develop an orthognathic surgery manual. She's also a writer, so she put up the manual together, and I will share that with you later. So she comes in. What do we see? She is 49, long face, chin to the left. I mean, good profile, longer facial third. When she smiles, she has a nice smile, a little mislevel. She has ankylosed tooth number 11. Beautiful profile. I mean, she has nice cheek. Look at her pupil right there. Her cheek is in front of it. She has nice nasolabial angle. And so you see, oh gee, why would you need a jaw surgery? She wants it because of this. Yeah, so 9 years of orthodontics. She finally finds somebody who would tell her, just go and have a surgery done. That's your only solution. And she's a nurse, UC Davis nurse, 20 years of experience. So you can see this is not even bracketed, it's ankylosed. So maybe that's why she got it, I'm not sure. But that's what she has. And her only problem is the bite. So her face is good, profile is good, airway is good, life is good, but bite is not good. So let's see what we did with bite-only surgery. So, but every patient, you know, and we'll look at her skeleton here, and if you look at those numbers, I mean, they just don't make sense. She has a beautiful profile, but her SNA, SND, this is a skeletal-based analysis. So the truth, past 6 years, I never even do that. The only person who does it is my insurance coordinator. She prints them out and sends to insurance company because the medical directors, they want to see Steiner analysis. So that's what they want. They want those numbers. If they have 3 dots right there, surgery is approved. If it's 2 dots, surgery is not approved. So this patient is perfect face, has 2 dots. Surgery is approved. Okay? That's her post-op day 1 in the hospital. So the mask that she wears, you see those, you see those, how do you call them, tubes? Yeah, they run freeze water through the mask, and that freezes your face and makes it cool down. So it is very, very good. So she's in ICU one day. So those patients, they stay in ICU for one night, and usually they go home next day. She wanted to stay a few nights in the hospital because she was very particular, and she took some pictures and she shared it with us. And so some people bruise like this, and some people don't. Most people don't. She took some pictures with the TADs in there, and she had multiple pieces of fort. This is her scans, and that's her face after. Okay, so why did she get more appealing face? We simply close her bite and move her upper jaws forward about 2 to 3 millimeters. Again, she had perfect jaws, but we just moved them a little bit forward. Why? Because I didn't want interferences in the back at the pterygoid joint, where maxilla, the tuberosity maxilla meets the skull of the base. If I move it forward, it's easier for me to do the splits and plate layer. So I did it for my convenience, to tell the truth, and obviously for the patient benefit. But that's her bite after surgery. She still has this ankylosed canine. You see, it's not acidic all the way, but she never had a bracket in it. It was defined ankylosed. So what happened with her profile? We simply made it shorter at the lower third. She got a little bit better defined nasal support here. And when I did her Lefort 1, I put the plates in the cheeks, and I lifted her subperiosteum. So we did subperiosteal facelift, so to speak. You know, that's what plastic surgeons to avoid to do, because the swelling stays longer. But we already were there. You know, we did glove her whole mid-face, so we suspended her soft tissue. So when you look at her, she has much better cheek profile now. Why? Because the soft tissue, all that side skin, we just moved it up, and yeah, make her look much younger. Look at her. So she was a little bit difficult in the post-ops. Again, she's 50. Imagine those people come, I have to mobilize them. You know, they don't want to open. I tell them, take 2 Percocets, come here, I have to stretch your mouth. You know, so she wouldn't let me. She would do it on her own, but she did a good job, and she got nice result. The book that we're publishing on the cases that will come out probably in a few weeks, and I will deliver it to you guys as soon as it get done. She published the whole chapter on post-op recovery, so it was really, really nice of her. So she was a happy patient, happy camper, and I'm glad we treated her.